The majority of us live under a dangerous clinical illusion. We believe that the moment we become diabetic is defined by a single, sharp needle prick in a sterile lab, followed by a doctor's somber look at a computer screen. But science tells a much more haunting story. According to the International Diabetes Federation's 2025 data, there is a ghost population of over 250 million people worldwide, individuals whose bodies are already failing, but whose lab results haven't caught up yet. Your blood test is a snapshot of today, but your peripheral nervous system has been tracking the damage for over 1,000 days. Your feet are the canaries in the coal mine. Because they sit at the absolute terminus of your circulatory and nervous systems, they are the first to pay what scientists call the distance tax. Every spike in your blood sugar acts like a microscopic drop of acid at the farthest point of your body. If you know how to decode the bioelectric Morse code your feet are sending, you can see the future of your health long before a diagnostic machine does. To understand why your feet start to fail, you must first visualize your nervous system as a vast network of high-speed fiber optic cables. Every cable is wrapped in a crucial insulation layer called the myelin sheath. In a healthy body, signals travel from your brain to your toes in milliseconds. But chronic high blood sugar is not just a passive number, it is a chemical corrosive. A landmark 2025 study in Nature Communications revealed that hyperglycemia leads to the formation of Nagiot nodules, which are essentially graveyards of dead nerve cells within your sensory ganglia. This is why the first sign is often a persistent, static-like tingling. Most patients dismiss this as their foot falling asleep due to a cramped position. In reality, it is a literal short circuit. The insulation is gone and the electricity of your life is jumping tracks. As this corrosion deepens, the signal quality doesn't just fade, it becomes distorted. This leads us to the nocturnal inferno, that mysterious burning sensation in your soles that only appears when you lie down to sleep. This is the sensory deprivation paradox. During the day, your brain is occupied with thousands of inputs, but in the silence of the night, the only thing your brain hears is the scream of damaged nerves firing heat signals when no heat is present. It is a fire alarm with a broken sensor. Many seniors compound this tragedy by reaching for ibuprofen or other over-the-counter painkillers, believing they have routine arthritis. But if that pain feels like a sudden electric zap or a hot needle, you are not dealing with joint inflammation. You are witnessing the hyperactive death throes of your peripheral nerves. Masking these signals with painkillers is like cutting the wire to a smoke detector while the house is smoldering. But the nervous system is only half of the story. The other half is the plumbing. Your heart is a powerful pump, but your feet are the farthest destination on the map. When glucose begins to stiffen your arterial walls, it creates a terminal pipeline crisis. Think of it as a drought hitting a garden. The plants closest to the well stay green, while the ones at the edge of the fence wither first. This is why you must look for the sunset effect around your ankles. If your skin is turning a deep, unnatural red or a bruised purple, it is not sun damage. It is microvascular congestion. The smallest capillaries have collapsed, and the hemoglobin in your blood is literally getting stuck at the end of the line, unable to return to the heart. This lack of irrigation manifests in even subtler ways that most doctors miss in a standard 5-minute exam. Consider the July freeze. If your feet are icy to the touch under heavy blankets in the middle of a summer heat wave, you are looking at a critical failure of oxygen delivery. The American Heart Association has linked this chronic coldness directly to peripheral artery disease. Furthermore, your body is a master of triage. It prioritizes vital organs over luxury systems. Hair follicles on your legs and feet are biological luxuries. When circulation drops below a critical threshold, the body stops irrigating the follicles. If you notice a sudden, smooth, bald patch on your shins or the tops of your feet where hair used to grow, your body is telling you that the water is no longer reaching the end of the pipes. It is a visual marker of vascular starvation that often precedes a major cardiac event by several years. Perhaps the most overlooked signs are those controlled by the autonomic nervous system, the autopilot of your body. Healthy skin stays supple because your brain automatically tells your sweat glands to release moisture. However, in the presence of long-term elevated glucose, these autopilot nerves are often the first to go offline. This leads to a condition called anhidrosis. Most people see their cracked, bleeding heels in the summer and buy more lotion, blaming the dry air. But you cannot moisturize a problem that is originating from a dead nerve. The skin is cracking because the internal irrigation system has been deactivated. These fissures are not just cosmetic. They are open doorways for staph infections in a limb that already has a compromised immune response. Similarly, we must discuss the sock mark warning. If you remove your socks at the end of the day and see a deep, indented canyon around your ankle that refuses to disappear after 30 seconds, you are witnessing pitting edema. While the swelling is in your feet, the crisis is likely in your kidneys. The National Kidney Foundation warns that 1 in 3 diabetic adults suffers from kidney stress. When your body's filtration plant fails, gravity pulls the excess toxic fluid to the lowest point. All of these signs culminate in the most dangerous symptom of all, the non-healing wound. In a healthy individual, a small blister from a new shoe is a minor inconvenience. But for someone with high blood sugar, their white blood cells, the internal repair crew, are essentially drunk on glucose. They move slower, they communicate poorly, and they fail to reach the site of injury in time. The CDC's 2026 data confirms that diabetes remains the leading cause of non-traumatic lower limb amputations. Most of these cases follow a hauntingly similar pattern, a small scratch or blister that the patient ignored for a week because they couldn't feel the pain due to the neuropathy we discussed earlier. You must adopt the 48-hour rule. If a minor wound on your foot does not show visible signs of closure within 2 days, it is no longer a skin issue. It is a medical emergency that requires immediate intervention. The tragedy of diabetes is not that it is untreatable, but that it is often caught too late. You do not need an expensive MRI or a specialist consultation to take the first step. You need a $12 A1C or fasting glucose test. This small investment can fundamentally rewrite the story of your next 20 years. Today, I want you to perform a 30-second audit. Sit on the edge of your bed, use a hand mirror, and look at the soles of your feet. Look for the discoloration, the vanishing hair, the sock marks, and the cracks. If you see even one of these signs, do not wait. Your feet have been gossiping about your health behind your back for a long time. It is finally time you started listening to what they have to say.